Good morning, and thank you for joining the South Georgia Healthcare Group's webinar series. My name is Amy Jones, and I'll be the facilitator for today's event. If you were able to join us last time, we discussed on the HR Bootcamp series. We discussed your resume, your cover letter, and your application. And today, with our panelists, we're going to discuss your interview process. Before we get started, I want to just go over a few specifics. This is being recorded, and we will share this with you through email tomorrow, and then it'll also be on our website, which is already in the chat room. We've also added links to the chat feature of the organization websites for our two panelists. And we're also, you can find our past webinar if you weren't able to join us on that last one. So we've also opened up the Q&A feature. We're going to ask some questions of our panelists today. But if you have any questions as we go through, please put it in the Q&A feature and we'll ask those towards the end. We will also have a survey up, a QR code at the end, and we appreciate if you would take that survey and give us some feedback. So we'll go ahead and get started. Today we have with us two panelists. We have Ms. Taylor Smith. She's with Tifton Regional Medical Center in Tifton. And we have Mr. Greg O'Quinn with Memorial Satilla Health and White Cross. Thank you both for joining us today. Ms. Smith, will you go ahead and just introduce yourself a little bit and tell us about your organization?
Sure. Good morning, everybody. My name is Taylor. I am a human resources generalist with TIP Regional Health System. And being a generalist just means that I am primarily responsible for basic HR tasks, recruitment, talent acquisition, and employee relations support. And my client group that I support within our organization is nursing and nursing support. And just a little bit about TIP Regional. We are a growing health system that serves South Central Georgia. So we have two hospital campuses, one here in Tifton, Georgia is TIP Regional Medical Center. It is our main campus. And then a secondary hospital location in Adel, Georgia, which is Southwell Medical. Mm-hmm. In Tifton, we also have our West Campus, which is a large multi-specialty physician practice. And then we have over 30 different clinics throughout the South Central Georgia area, as far north as Ashburn and as far south as Valdosta. We have around 2,700 total staff members, and we are always recruiting. We have lots of different positions open, but some of the ones that we are constantly looking for good talent in is our direct patient care roles. So those can be entry-level roles like patient care techs and CNAs, up to more experienced clinical specialty roles like respiratory therapists, licensed practical nurses, and registered nurses.
That's a great array of careers. Thank you for sharing that. Mr. O'Quinn, would you share a little bit about yourself and your organization?
Yes. Good morning. As Amy said, my name is Greg O'Quinn, and I work for Memorial Satilla Health here in Waycross, Georgia. I've been employed here this upcoming January will be 10 years. During that time, we've seen a lot of changes here at our hospital. Today, we are owned by HCA, or Hospital Corporation of America, which is a large healthcare organization here in the United States, has a footprint throughout the United States, mainly in the Northeast and the South and Southeast. Our organization today, we have about 600 employees here. We have a lot of ancillary services that support our hospital. We have a lot of physician offices here that are directly affiliated with the hospital, that are strategically located within walking distance of the hospital. We employ a lot of contract staff, and so we have about 600 of our own hospital employees, but then you can add probably anywhere from 200 to 250 contract staff that routinely work here in our hospital on a daily basis. So we are a large employer for our area, not as big, of course, as the hospital over in Tifton, but we do employ a lot of folks here, and we have a lot of different types of services. Most of the jobs that we routinely recruit for are very similar to what Taylor mentioned: registered nurses, LPNs, PCTs, or CNAs. And then we also have very specialized jobs as well, as far as respiratory therapy is concerned, radiology. We also have a cath lab where we employ a lot of different types of specialties as well. And so we are always recruiting. We currently have a number of RM vacancies that we recruit for on a daily basis. And so we look forward to anyone that wants to join our organization, doing everything that we can to recruit them and onboard them properly to make them a successful member of our team.
Well, thank you for that. And as we go into this, understanding what the onboarding process looks like, that's what we're here and to share that with you. So let's go ahead and get started with our questions. So the first question I want to ask, and I'll start with you, Greg, what are the various types of interviews that you do, especially now with COVID? You do some maybe platform interviews like this Zoom or a WebEx. And so tell me about the difference between either a phone interview, a Zoom interview, and then what the in-person interview might look like.
Yeah, definitely. So for probably about a year, we did not do any in-person interviews. All of our interviews were done through WebEx or through a Zoom call. And that's all of them, from entry level all the way up to our director level and senior leader type positions. We relaxed that probably around after the beginning of this year, and we started going back to in-person interviews. And so we continue to do those. We will bring a candidate to our campus, and they'll have an initial interview with their director or their manager for the position. And then if that goes well, then we'll have a peer team interview where the candidate will interview with 2 or 3 or 4 individuals from that department that are working in a similar role to the position that they've applied for. And then after that peer interview is completed, if there is a job offer to be made, then I work with our recruiters to make that job offer, and we move forward. We continue to do interviews that are very similar to this than what we're doing today. We just hired a director level candidate that came to us from Kansas, and so we interviewed her originally via WebEx. And we did the first initial interview and the second interview with our senior leaders via WebEx.
Okay.
And then we brought her on site at a later date. So we continue to use this format to do interviews as well as in-person interviews for our entry-level positions.
Thank you. Taylor.
Yeah, we in a very similar boat to Greg. So over the last 2 years, at some points we halted all in-person interviews. Currently, it's kind of location based as to whether we're bringing people in person or doing things over Zoom or over Teams. So what I can say about ours is typically the content is pretty similar. Again, just location based as to whether we're going to decide to bring you in or do it on Teams, but definitely some of the ways that you can prepare will be a little bit different. So we are all still getting used to doing things virtually. I know it's not 100% natural for everybody yet. So when I'm prepping candidates to do video interviews, a couple of tips I always go through with them is practice. Make sure that your technology works. The vast majority of the candidates who connect with us via video do it from their cell phones. So most of these platforms don't require any special downloads. And again, vast majority access that via iPad or cell phone. But hop on, do a test run with a family member or a friend to make sure that your microphone works, make sure that your camera works. Plan ahead for where you're going to do it. Pick a place in your house or school or wherever you're going to do the interview. Make sure that it's quiet, distraction free. So we all have other family members and pets and different things at home. So just a little bit of extra preparation and preparing for video interviews, especially if it's your first one, I think goes a long way in helping candidates be successful in those.
I think that's some really great insight and helpful information. So, I had asked about the phone interview. Do either of you start with phone interviews, or do you go straight to maybe a Zoom or WebEx interview?
So we do, and initially that original phone screen is done by the recruiter. Okay. So really it's just a real quick kind of get to know you. Are you going to be a good fit? Answer any questions that person may have, that candidate may have, because it's got to be a good fit on both sides. So we don't want to burden anybody here with an interview for somebody that's not going to be considered. Time is very valuable now, especially with our leaders. And so we want to have our recruiters do that first intake phone screen. And if they feel that it's going to be a good fit, then we go forward with the director manager interview. But if it's not a good phone screen, then we'll stop at that point with the candidate.
So you said if it's not a good phone screen, and then also I've got 2 questions on that. So how long is a phone interview? Is it usually 5 or 10 minutes?
I would say so. I would definitely defer to Taylor for her to provide feedback, but 10 minutes max, you should be able to get the information that you need As long as, and it go back to what Taylor said too, even these phone screen interviews need to be done in a way where it's quiet, where it's calm, where you can focus, where you're not interrupted. And so even though it may be 10 minutes, you definitely want to be professional. You want to have your information available so you can respond appropriately and timely. It's really a setup for the next interview. And so as long as that goes well, then we will roll them right into an interview with the director manager as soon as possible. But again, I defer to Taylor. They may do things a little different.
Yeah. Yeah, and we do very similar. So we do for the vast majority of our positions, a recruiter may reach out and do a quick phone screen, not necessarily for 100%, but for the majority of ours. And again, like Greg said, it'll just be a quick kind of get to know you session. If we had any questions about anything on your application or your resume, if there's anything specific as far as job duties, hours, schedule that we need to review to make sure that it's a good fit. So yeah, we do touch base. And again, 5 to 10 minutes, usually a quick conversation. We can answer any questions that the candidate has and just be a point of contact and resource. But like you said, with phone interviews, make sure that if you're putting in job applications, we don't always set those up ahead of time. So we might just pick up the phone and call when we're reviewing the application. So be mindful of how you answer your phone when you're actively in the job interview process. I always tell people maybe be mindful of your voicemail, making sure that's set up, kind of monitoring what that says. So just different things to think through as you put in job applications and maybe are expecting calls from recruiters.
And that's a good point too, because if I were to apply with either of your organizations and I get a call from a recruiter, it might not say Memorial Satilla Health or TIF Regional. But if I'm applying for jobs, I need to answer those phone calls. If from a place that I may not recognize, if you're wanting to get a job, you need to be aware of that phone etiquette.
I think that's a great point, Amy. And as we work more like this now and in the future, I mean, our recruiters are not local. Our recruiters are going to be calling from Charleston, South Carolina, or Jacksonville, Florida.
Okay.
So a lot of times we will let candidates know that you may get a phone call from an 843 or a 904 number. That's our people calling you to either go forward in the process or to ask more questions. So I think that's a great point. People may be expecting a phone call from a 912 number, and that just doesn't happen because we have a lot of shared services in our organization, and our recruiters will be recruiting from multiple facilities. And so they're not necessarily located right here in South Georgia.
Okay. And so also, when you're thinking about that first phone interview and it being a good fit, so as an example, that may be they're looking for a day shift and what you have to offer is a night shift. And that could maybe not be a good fit. Is that what you're talking about?
Yes, absolutely. And a lot of different things, salary, a lot of times candidates want to talk about compensation are very much in the forefront of the interview. And a lot of times if that's going to be a disqualifier, then there's no need to move forward if that person's hourly rate is just not in line with what we're willing to pay. We really don't want to waste anybody's time, going through an interview process if we're not going to be able to meet that person's compensation expectations. So a lot of times they'll talk about the grade for the pay, and they'll absolutely talk about our benefits, which are our big selling point for us. But those are all things that can be discussed in that intake or initial phone interview.
Taylor, do you have anything else you want to add before we move on to the next question? Okay, thank you. So the next question I had was, what should you wear? On a phone interview, obviously it doesn't matter, but a Zoom interview or, an online platform like that, and then also the in-person interview, what are your expectations? And maybe also what are some things that are, some absolute no's that when you see that gives you a kind of a red flag. So Taylor, do you want to go ahead and start with that?
Sure. Yep. So the thing that we always emphasize with dress code for interviews is professional. So, most of the time you're going to have something in your closet that's appropriate for an interview. So especially for entry level, we're not expecting you to go out and buy a new suit. If you don't have one, you can certainly wear a suit if you have it, but just professional attire. So business attire, slacks, khakis, can be a collared shirt or a blouse. And then I would dress for a Zoom interview the same way that you would dress for an in-person interview.
Okay.
So even though you're not seeing the entire outfit, you wouldn't go to an in-person interview in your pajamas. So certainly don't attend a virtual interview that way. Some of the red flags are, don't wear jeans, don't wear any clothes with holes or rips. Make sure that your clothes are cleaned, make sure that they're pressed. Again, just that first impression goes a long way. So I know a lot of people stress about what to wear in interviews, but like I said, most of the time there's something in your closet that'll do. Doesn't have to be anything extra fancy, just business attire and professional. And the other part of dress code that people don't always think about is a lot of your appearance is your attitude. So smile when you walk in, and be friendly and be upbeat and enthusiastic. The first person that you encounter when you get there might not necessarily be the person that you'll be interviewing with. It might be someone at reception or at a desk, but it could be someone you'll be working alongside, and those people certainly give feedback. So be friendly and attentive with everyone that you meet along the way. And then also, not necessarily something that we think of with dress code, but what to bring with you is I would always bring copies of your resume. We usually say 5, just because you're not always sure who all you'll be meeting with. A notepad if you needed to take notes, but there are certainly things that go into that first impression beyond just what you have on.
That's great. Greg, do you have anything you want to add to that?
No. I mean, I do. I think she really nailed it. I would say, dressing professional doesn't mean that you have to wear a suit to the interview. I would agree absolutely with what Taylor said.
Okay.
We tell our hiring managers that all the time. That doesn't mean that they're not dressed professional if they're not wearing a suit. Business casual is fine. But again, we want people to show up on time, dress professionally, with the right attitude. As Taylor mentioned, they should be engaged in that conversation. We should not feel like we're having to pull information out of them during that first interview. And so I agree with her, agree what she said. And also agree that in this format here, you still should dress professionally, and you should still have that same engaged attitude and be friendly, even though it is over a different type of medium that you're conducting the interview. I think all of those things still hold true. I still think you are on time. I still think you dress professional and you be engaged in the conversation, and that'll go a long way towards you having a successful interview.
And I think that's a good point, because when even if it be a virtual platform like this, if you're dressed in a professional way, it could put you in a different mindset and get you prepared. It's kind of getting ready for the day, getting ready for the interview. And and when you talked about engaging with the people that are coming in, that kind of puts me into our next question, is that you have different types of interviews. You have some supervisor managerial interviews, and then you also have those peer interviews. And maybe that person that you first interact with may be part of that peer interview. So tell me a little bit about the difference between the peer interviews and the supervisor interviews. Greg, if you want to start.
Yeah, so from our perspective, we're actually just going through this training with all of our staff and basically retraining them, because we've not really done that since about 2018. But really, you want to, as Amy mentioned and Taylor, you want to dress professional for these interviews. Typically, anytime you go to a peer interview type group, you're going to meet with a director and a manager first, maybe both of them together. In most cases here, we would rather do that interview together. Then if they feel comfortable and confident with that candidate, then they're going to move them on to a peer group, and that peer group is going to interview them, and it's a panel. Typically that's 3, 4, 5 people. I think 4 is plenty, depending on the type of position. But you're going to have an interview with that panel group, and they're going to ask you behavioral based questions, which are really questions developed to facilitate conversation, to get the person talking. They're not yes or no questions. They're open-ended questions that are going to require some back and forth and some dialogue. And that's the whole purpose of those questions being designed the way they are. So I think that they're fair. They really rely on past experience. So no theoreticals, no hypotheticals, no would or could. It's going to be, I have actually done this, and you're explaining and articulating how you handle that situation. So Behavioral-based interview questions are designed to develop conversation and also try to decide whether your past performance is something that is going to work well here or where you're interviewing. So there's a method to those questions and why they're the way they are. But there's no right or wrong answers. As long as candidates can explain real life experiences and real work experiences, then they're going to be fine. I think as long as you don't have just yes or no answers, you'll be fine with behavioral based questions.
And maybe you had mentioned, you know, that they're going to be based on past experience, but if there may be entry-level positions and they don't have that past experience, they can use those real life experiences.
That's right. And we talk to our groups a lot and say, listen, with some of these younger candidates that are coming through, they may not have had jobs or they may have had one job. And so real life experiences, things that they've had to deal with in school, things that they've maybe had to deal with doing clinicals and things like that, are very relevant and things that they should share. But we can't get bogged down when asking the questions that it has to relate directly back to a job, because some people just don't have that experience to refer back to.
Right. Taylor, what is your input on this?
Yeah, very similar process to Greg. So we do manager interviews and peer interviews. Like Greg said, ours are usually groups of 3 to 4, which can be very intimidating to people when we get that. But the purpose is really, you know, it's as much for your benefit as it is for the organization's benefit. It's, you know, it's to give you some interaction with the people that you would actually be working alongside, the people who would be training you and precepting you and supporting you, so that they can make sure that you would work well with that team. And we do behavioral based questions as well. And those can be challenging questions if you're not prepared for them. So I certainly suggest doing some research ahead of time and have some practice questions. There are some great examples of behavioral based interview questions online. And I think more and more organizations are moving towards these questions because, like Greg said, it gives you an idea of how the person would handle themselves in certain situations. And so where it's not necessarily skill-based, because everyone's pressed for talent. And when we're looking for a patient care tech, we have the training needed in place to train you how to take vital signs or chart an appointment record. But what we're looking for is, do you have those more soft skills that are going to make you be successful in that role? It's harder to teach someone to have empathy or compassion or have that knack for patient care. So those are some, you know, we're really looking for more of those soft skills in those behavioral based interviews. And I always tell candidates, you know, have 5 or 6 examples from your past. Like Greg said, it doesn't have to be from this position. It can be from something that happened to you at school, in a non-healthcare related job, something that happened at home or with friends. But just think through specific situations from your past that you're particularly proud of, that showcase things like customer service, problem solving, and just be ready to talk through those situations. And so, you know, like Greg said, it should be a conversation. It shouldn't be a yes or no. Really explain what was the situation, what did you do in that situation, and then what was the end result. And that's really how we want to hear people talk through those questions or scenarios.
And was mentioned, it's a conversation, and so it's a back and forth, and not just that yes and no. So be practicing for those detailed questions. We've got one question in the Q&A. I want to go ahead and get to that too, because we're actually running out of time already. So it asks, what are you looking for to consider a good candidate for an RN? Are there different expectations due to experience? As far as the NCLEX, are they being waived due to the high demand for RNs?
No.
So the NCLEX is not being waived.
Not to my knowledge.
And are you looking for specific LPN or RN or both?
So I'll say we look for both. Our biggest areas of opportunity right now, though, is with registered nurses. We have a lot of RN vacancies, and that's throughout the house. That's the emergency department, ICU, PCU, our med surg areas. We have had a much more difficult time recruiting to our med surg areas than our other areas. Most new nurses now, they want to go to critical care of the emergency department, and that we try to steer them to some other areas. But as far as what we're looking for in a good candidate, it's some of the things that Taylor and I both mentioned in the previous answer. You know, being on time is important. I know that seems very, very minimal,
Right.
but it's not, because I feel like that's a precursor to how their employment is going to go. If they're late for that interview, they're going to be late for work, and that's just a fact. I've been doing this long enough that just doesn't change. Be professional, and that is a time to brag on yourself. That is an opportunity for you to impress your possible employer. So if there's things that you've done in your past that you're proud of and they relate directly to your work experience, absolutely bring that up. But you know, the healthcare market is very competitive now, as competitive as it's been since I've been in healthcare. The demand for certain types of jobs is extremely competitive. And, you know, Taylor is an hour and a half away from us, but we're probably competing for the same type of candidates, and everybody in between us is too.
Exactly.
And that is a real thing. And so these people are mobile. They have options as to where they can go work. And so we are trying to do a better job of selling ourselves as much as the candidate is trying to sell themselves to us. And then we make a decision on whether it's going to be a good fit. But to me, it's extremely important to be on time and be engaged. Those are two things that everybody can do, no matter what job it is. You can be on time and you can be engaged in the conversation.
And that's a good thing that they can start right now while they're in school, is making sure that they show up to school on time, because that's going to continue through their life. And that's going to be any job. This is not just in the healthcare.
That's correct.
Right. So we're already out of time. It's been a quick 30 minutes, and I appreciate those that have joined us today. Greg had mentioned going through that workplace culture. We're going to discuss that next week on November 16th and discuss the diversity, equity, and inclusion in a workplace. And then we're also going to discuss the privacy and safety protocols within healthcare. And we hope that you can join us then. So I want to thank both of our panelists today for joining us. And we'll have the QR code for the survey to come up. And we really appreciate your time in joining with us today.
Thank you.
Thank you.
Appreciate you guys.